Good evening, my audience. Today we'll speak about important subject in CNS for the radiologists and radiographers and physicians, which is brain CT scan and basic interpretation. Let's say part 1. CT scan of the head is extremely useful as a diagnostic tool encountered in emergency setting. The treating physician needs to be able to accurately interpret it and act upon certain CT findings without the presence of the radiologist. This is the aim of the study, because many diseases are time dependent and require immediate action. We will talk in this lecture short talk about the basic principles of the CT scan. Then we'll go to the normal neuroanatomy as seen on head CT scans, supported by multiple illustrations. And in the second part of the talk, we'll cover the functional and lobar anatomy of the brain. This is Sir Godfrey Housefield, he's an electrical engineer. 1972, he won the Nobel Prize for Physiology in Medicine. The Housefield units, which is the term unique for the CT scan, is named after him. Through the years, CT scan have come from one rotation to 6 rotations to nowadays multiple rotations and multiple detectors and highly diagnostic machines. This demonstration is of the initial sketch of the CT scan machine by this inventor, and this is the image of the experimental CT machine, and this is our respected scientist with his initial working prototype CT machine. And this is assumed the first original CT image from the dedicated Silverstone CT scanner in 1975. Quickly, the parts of CT machine includes the gantry, which houses the X-ray apparatus, X-ray tube, detectors, patient couch or table, and viewing console for the radiologist or radiographer. The X-ray is emerged from the X-ray tube through the body to the detectors. And usually we take cuts to cover the area of interest. These cuts range from high resolution 0.mm cuts to 10mm or even more if needed. And this is a simple scheme of the process of X-ray and CT scan, where image reconstruction is followed by digitalized image and come to a true image on the screen. Now we come to the clinical indications for brain CT scan. On the top of the list is acute acute stroke and transient ischemic attack, acute headache of variable causes or acute neurological deficits, acute head injury, suspected hydrocephalus, mental status change, or secondary indications when MRI is not available, including some eye problems, diplopia, CNS, seizure, syncope, and etc. Always we describe CT scan findings as densities, either isodense or hypodense or hyperdense. This is the basic description of a pathology. Higher density, whiter appearance, we mean lower density, darker appearance, and the brain tissue is the reference density. Anything of density equal to the brain is called isodense. Higher density is hyperdense, example is the skull bone. Anything darker is hypodense, like CSF, and here are the classical examples. House field unit related to composition and nature of the tissue, and it is represented as the CT number as a terminology. And we'll give you some examples of the CT numbers encountered in brain CT scan. Fat in the minus 70 range, here on the top of the minus range, approaching 1000 minus value. Pure water is around 0. CSF plus 8, white matter plus 30, grey matter plus 45, blood around 60 to 70, and bone and calcification, the opposite of air, which is the higher density of plus 1000. Now we'll come to the neuroanatomy as a normal findings when interpreting the brain CT scan. To be honest, knowing the normal neuroanatomy as a radiologist or radiographer is the core of knowing the pathology. Once you know the normal, you can recognize the abnormal. This is the golden rule for each radiologist or radiographer practicing and using the CT scan or even any other radiological machine or imaging. We'll start with the axial sections. First of the passing the posterior fossa cuts, which is the lower cuts of the brain CT scan. These include the following structures that lie between the foramen magnum and the tentorium, passing through the fourth ventricle and above and below the level of the fourth ventricle. These are the constituent of the structure of posterior fossa. What remains of the brain, we call it the supratentorial cuts, includes as landmarks third ventricular level, lateral ventricular level, and above the ventricular level. This is leveling of the anatomy when we go to details. This is a scheme of the lateral image of the brain, and this is the true image that the radiographer will start his image with. We put our slice in the bottom of the brain, oriented from the lateral foramen magnum toward the frontal bone, passing through the sphenoid sinus. What we can see in this section really is the orbit anteriorly, the sphenoid sinus, part of the very inferior aspect of the temporal lobe, external auditory canals posteriorly, and mastoid ear sinus, and part of the inferior aspect of the cerebellar hemispheres. This is from anterior to posterior in the basic cut that we start our image with. Subsequent cut will further show parts of the frontal bone anteriorly, as we see here, of course, right and left. Frontal bone itself and superior surface of the orbital part, dorsal assembly structures, including the CSF space of the suprasellar and chiasmal systems. Here we have the basilar artery in the prepontine system, temporal lobe, right and left, and mastoid ear sinus. Also the cerebellar hemispheres, more clarified than the previous cut, and you notice how the cut is passing through all what we mentioned of the posterior fossa and anterior aspect of the brain structures. If we go further, we can see that most of the tissue is brain tissue, and we'll see anteriorly the frontal lobes, right and left. Now there is the appearance of the sylvian fissure on the left and right, and temporal lobes, including the temporal horns, and of course in the central, the suprasellar cistern and pituitary stalk, midbrain structure, and the fourth ventricle and cerebellar hemispheres, and this is the corresponding cut. If we go higher, this is the level of the third ventricle. These are the inferior aspect of the frontal horns of the lateral ventricle, and this is the quadrigeminal system posterior to the midbrain, and also the cerebellar hemispheres and part of the sylvian fissures. Higher cut will show truly the frontal horn of the lateral ventricle. This is the caudate nucleus, and this is the lateral to anterior limb of the internal capsule, and here the posterior limb of the internal capsule, and here the genome. Here the lentiform nucleus, globus pallidus, and medially and laterally. Here is the external capsule region. Quadrigeminal system. This is the uppermost part of the cerebellum in the middle, which is called the middle cerebellar vermis. And the cerebellum has the uppermost part anteriorly, and starting here posteriorly is the occipital lobes, frontal lobe anteriorly, occipital lobe posteriorly. This is true lateral ventricular level, starting anteriorly by the geno of the corpus callosum. This is the geno of corpus callosum, frontal horns of the lateral ventricle, anterior horn we call it. This is again the internal capsule. This is clearly the bilateral thalamus, left and right. It starts to appear here in the pineal body, pineal gland, posterior to the third ventricle, superior to the rectum, and highest part of the cerebellum. This is the occipital horn starting to appear of the lateral ventricle with the choroid plexus. And this is the straight sinus passing in the tentorium. True body of the lateral ventricle is appearing on the right and left. Here, the cut is passing through the posterior part of the corpus callosum, which is the splenium, and this is the body, and this is the genome. The parietal lobe starts to appear on both sides. We are approaching this area. Here the frontal, here the occipital, here the parietal lobes. And superior sagittal sinus is starting to appear because we reach its level in the midline, covering the cerebral convexity, and here part of it, and here part of it. This is the top maximum point of the brain, which is exclusively showing the cortex and the superior sagittal sinus. This is the delta of it, and the brain here is divided into sulci and gyri, and the central part is the falx. We end at this point, and in the next talk we'll talk about the functional and lobar anatomy and related to symptoms and other part of the neurobiological anatomy. Thank you for listening.